Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is my colleague at Family Practice Associates, Dr. Mary Henkel. Welcome.
Thank you.
Now, I twisted your arm to come in and talk about supplements and vitamins, and they're all over. I mean, store shelves are just filled with them, okay? And so people are taking them, but are they good or are they bad?
Well, they're mainly good, but if you take too much of a few of them, it can be bad. And there are certain medicines that can interact with some of the vitamins.
So if you do take them, you need to make sure you tell your provider you're taking them.
Yes, and go over the medication list with the patient and which vitamin. And for instance, if someone's taking ginseng, that could thin their blood, and that might be dangerous if they're on one of these new blood thinners or the older one, warfarin, any of them.
Well, this is a picture of a vitamin shelf at a store, so people are taking them whether we want them to or not. So let's go over some vitamins one at a time here and see if they're any good. How about vitamin K? Are you worried about them with any certain types of medicines?
I am. What first worries me is that people might think that that's potassium, and it's not. It's vitamin K, and it can be involved with affecting the way you clot blood. And so you have to be very careful if you're on a blood thinner and taking vitamin K.
So really, you probably shouldn't be taking it. But how about vitamin B?
Vitamin B has been well known to help with nerve health and memory and energy. So that's a good vitamin, and you really can't get too much, at least vitamin B12.
But you can actually have your level checked if you're concerned.
You can, yes.
How about calcium?
Calcium is extremely important, especially for women 50 and over, or when they've had if they've had a hysterectomy earlier, and combined with calcium, vitamin D with calcium is the best we know as far as a supplement to help with bone strength.
You can also get that through diet.
You can, and well, fortified milk and sunlight.
Okay. Turmeric, is it really any good? Does it help anything?
I've had several patients tell me that turmeric helped with their joint pain and their anxiety. I personally don't know if it's that helpful, but I think that there have been studies that have shown that it's worth trying.
And there's no concern about overdosing on turmeric?
Not that I'm aware of.
Okay.
But vitamin D, back to vitamin D, you can get too much vitamin. Oh, there it is.
Yeah.
Okay, and it can make you sick to your stomach. It can make you start to have nausea, vomiting, and confusion, and increase the amount of urination.
So if you have osteoporosis, the vitamin D and calcium can be important, but you want to talk to your doctor about how much and if it's working for you.
Exactly. It's easy to remember 1,000. So just try to remember to take 1,000 of vitamin D combined with 1,000 of calcium, and you got it.
Okay. And you can also have your vitamin D level checked.
Yes.
Okay. All right. How about magnesium?
Magnesium is more recently, I think, in the news as far as being a helpful supplement or vitamin, and it's supposed to help with memory, migraines, and fatigue.
Okay. Fish oil.
Fish oil is supposed to be very helpful for protecting our vessels from plaque formation.
Now, they make fish oil in a prescription, but they also have it in just regular over-the-counter. It kind of tastes bad sometimes.
It does kind of taste bad sometimes.
Okay. How about just a regular multivitamin? Do people really need to take that?
So for the first 25 years of my practice, all I knew is to tell patients when they turn 65, start taking a vitamin, because you don't absorb vitamins as well after a certain age. And the past couple years, it's exploded with other supplements and vitamins, but definitely a multivitamin if you don't eat out of the 6 basic food groups, or if you're 65 and older.
It's probably not going to hurt you anyway.
Not going to hurt you.
Okay. Now, probiotics, that's kind of a come and go thing, correct?
That is. And right now, I don't believe probiotics are as on the up and up as they were a few years ago. What do you think on that?
Well, with antibiotics, I always told my patients to take them. Do you think it helps with diarrhea?
I think that you would have to be on probiotics for a time frame before it would really help, but it's not going to hurt you to take it with the antibiotic.
Okay. How about CoQ10?
And CoQ10, that's what's supposed to help our muscles not be as sore if we're taking a statin drug, and it's supposed to also be helpful for helping with the plaque in the vessel.
And there's a lot of patients who take statin medications, so
Yes.
it might be helpful.
Yes.
All right. Well, thank you for coming in. Thank you for letting me know.
Thank
And
you. Thanks for having me.
If you're on a supplement, let your doctor know. We'll be right back.